pile is derived from the Latin word pila, which means a ball. Thus a growth in the anus which is similar in ball-like shape is designated as piles. Piles, also known as hemorrhoids, as vascular structures in the anal canal. Hemorrhoid tissues are cushions of blood vessels that swell slightly during bowel movements. Too much pressure on the anal canal can make these tissues stay enlarged. They may become inflamed and cause symptoms. This can happen both inside and outside the anal canal. Piles are divided into two categories: internal piles and external piles. Internal piles usually can't be seen or felt, and they rarely cause discomfort, whereas external piles occur as close to the anal canal, which can be painful if blood clots inside the lumps. External hemorrhoids are hemorrhoids that affect veins outside the anus. These hemorrhoids can cause bleeding, cracking and itching. Hemorrhoids are often caused by straining while having a bowel movement. Symptoms of hemorrhoids are pain or a burning sensation, bleeding during bowel movements, protrusion of tissue from the anus, feeling of blockage or fullness in the rectum during bowel movements, itching around the anus, and mucus discharge from the anus. Cause of hemorrhoids are too much pressure on the anal canal, which can be due to chronic constipation, straining during bowel movements, sitting too long on the toilet, strenuous exercise or heavy lifting, pregnancy, childbirth, aging and diarrhea. Complications of piles are profuse hemorrhage, strangulation, thrombosis, gangrene, fibrosis and perianal hematoma. Etiology of hemorrhoid are straining and constipation, pregnancy, obesity, prolonged sitting, portal hypertension, chronic diarrhea, colon malignancy, loss of rectal muscle tone, spinal cord injury, rectal surgery, high socioeconomic status. According to Ayurveda, Arsha, meaning piles, pertains to a disease occurring in Guda, and it is torturing to the patients. It may cause obstruction of the anorectal passage. On the basis of the predominance of dosha, piles or Arsha is classified as Pitaj, Pittaj, Kaphaj, Raktaj, Senapitaj and Sahaj. According to origin, there are two types of Arsha, Sahaj and Kalaja. And the classification on the basis of prognosis are Sadhya curable, Yapya palliative and Asaja incurable. Piles cure capsule, presented by Deca Herbals, is composed of various medicinal herbs such as Atibisha, sunnah, kanchanar, rajvrikshya, Rittha, Machanimba, Lajjalu, Marek, and other ingredients with antioxidant, anti-inflammatory, antibacterial properties that balance the tridosha and helps to get rid of piles and fistula-related problems. Piles Cure capsule is taken 1 to 2 capsules twice a day before meal or as directed by the physician. It does not contain any ingredients that can harm infertility, pregnancy and lactation. Piles Cure capsule can be administered with medical supervision only. In order for the capsules to work effectively, patients should cautious about avoid eating spicy, oily and sour foods. The capsules must be stored in airtight container after use, away from direct sunlight.